Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President, CEO of the National Black Leadership Commission on Health, Incorporated, formerly known as the National Black Leadership Commission on AIDS. Our mission is to champion the promotion of health and prevention of diseases, to reduce disparities and achieve equity for the Black community. We work to achieve this mission through advocacy, policy, and action, with a focus on 8 health disparities that disproportionately impact Black African American populations. That includes HIV/AIDS, hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, and mental health. And so today, we are excited to talk about a post-COVID community mental health project that aims to create greater awareness through education on mental health risk, provide resources, and improve connections to behavioral health. Through a partnership between Columbia Psychiatry, the New York Public Library, Black Health, and made possible through support from the Leon Levy Foundation, the project's specific focus is in communities most impacted by the COVID-19 pandemic. Our guests today are Dr. Patrice N. Douglas, licensed marriage family therapist and also a doctor of psychology based in Southern California. She is the owner of Empire Counseling and Consultation, located in multiple states. Dr. Patrice specializes in many subsets of psychology, including anxiety, addiction, relationship health, and multicultural issues. And she serves as the mental health consultant for Black Health. Luis O. Lopez has an MA and a BS, and he is the director of special projects at Centers for Practice Innovation, CPI, and coordinator for Fidelity and Best Practices at the Assertive Community Treatment, ACI or ACT Institute. He's also a counselor, a trainer, a consultant, and a coach. And Luis received his MA in counseling from New Jersey City University, MS in administration from Metropolitan College, and has been at the New York State Psychiatric Institute since 2030. And Linda Rosenberg, one of my professional sisters, has her MSW, and she is the Director of External Affairs at Columbia Psychiatry. And prior to joining Columbia Psychiatry, Linda spent the past 15 years as President and Chief Executive Officer of the organization, which is now the voice of the nation's safety net mental health and addictions treatment organizations. Welcome, welcome, welcome. We clearly have the right persons in the studio to talk about mental health and this project. And we're going to get right to it because I want all of the time given to you to tell us about this exciting project. So Linda, when I said you're my professional sister, because I received my master's in social work from Indiana University. So why don't you get us started and tell us somewhat about how the project was conceived and why we're here today.
Sure. I'm delighted to be here. And the project really began with Shelby White, who is the founding trustee of the Leon Levy Foundation. And she got together two of her colleagues and friends, Jeffrey Lieberman, who is head of psychiatry at Columbia, and Tony Marks, who's head of the New York Public Library. The three of them wanted very much to address the really emotional needs post-COVID of local communities. You know, the loss, the grief, the fear, and they thought what better way to do it than to take the expertise of Columbia and partner it with the trust that I think New Yorkers have in their library. You know, for many of us growing up, the library was a safe place. It was a place to go and study and learn, and so it was great. And we were very fortunate that the library had a relationship with Black Health. And because of that, they joined us in a three-way partnership. And that's how it all began. And then we put our heads together around, well, what are we actually going to do? And we understood very much that we had to hear from the community about what they wanted and needed, not what we thought they should have. And I think that's where I want to turn it over really to Patrice and to Louis, who were part of those community meetings.
Okay, so tell us a little about the community meetings. How many have you had? How did you organize them? Because community meetings are not the easiest things to do.
Exactly. You never know.
Absolutely. So tell us a little about the community meetings in terms of how that came together, and what communities currently are you focusing on here in New York?
I could kind of break down how they were divided, and Dr. Douglas could go into the specifics of facilitation because she was the person that did that. She was brilliant. So the project focused on 3 communities. We had interviews with individuals that were more of a mature stage in their lives, right? And we also interview individuals that were in their early 20s, young adults. And then we also interview individuals that were in their teens. So there were 3 groups: teenagers, young adults, and people, what they call the seniors, but more mature in age.
I guess I fall into that category, huh?
Me too.
I was thinking the same thing.
And so proud to be.
No, absolutely, absolutely. Tremendous amount of wisdom. But the interesting thing, right, is that we were focusing mainly on communities in Washington Heights and the South Bronx. And with those communities, not only you have the cultural richness that each of these groups come in with, but also the challenges that are identified through social determinants in those communities, right? You mentioned earlier all the different areas of medical needs that these communities have. You could clearly add COVID to that now. The CDC has posted very clearly the challenges that these communities, particularly Black and African American communities, had with COVID. Compared to white communities, infections 2 to 1, hospitalizations 3 to 1, and deaths 2 to 1. And if you add the Latinx community into that, the differences between both BIPOC communities and white communities is much higher. So you could add COVID into that, and the level of stress makes it a perfect time to bring this type of education to a community that already was struggling. They didn't need COVID. COVID just multiplied all the stresses that they're going through. And this is where we began to talk to the actual community members, and Dr. Douglas did that.
So the purpose that we came in as Black Health is that we wanted to take those 3 groups, and those 3 groups are typically the groups that are often ignored. The adolescents, you know, they're teenagers, so you know they're just trying to figure out life and go to school. When they talk, people really don't understand them or listen to them for clarity. Then we have the young adults who think they're adults, but they're still kind of figuring life out and thinking they have to figure it all out at that particular time. And of course, the seniors is the ones, well, you know, you guys have the most, you know, experience in life. You know, we don't think about you still have needs. So when I came into the project, I really wanted to make sure that their voices were heightened and that they were listened to and they weren't silenced. By making sure that when we turned these animations into what would be amplifying their voices, I also wanted to make sure that they felt heard.
Dr. Douglas, maybe we can explain that the outcome of those community meetings is to produce a series of animated videos, which we're going to push out through every social media channel and traditional media as well, and that those videos on the topics that you got and elicited from the community will be accompanied by programs in the local libraries where we will bring people together face to face and really do a few things. I think allow them to network, allow them to share their experiences, and to get really good information. You know, one of the things, there's a lot of information out there, but we're very lucky, I think, at Columbia to have a faculty that is very expert, like Dr. Douglas, like Lewis, who will be part of those symposiums that will be put on by the library. So that's the plan. Have it all over social media and then give people opportunities to come together, digest it, have a leader, and also get connected to treatment if that's what they need.
And that raises another question that I want us to get to, and that is specifically what other programs and what are the topics of the videos, the animated videos, and how was it decided or determined those specific topics? I know there are going to be 10 that will be launched.
Correct, yeah.
And so you
Yeah.
want to continue to speak to that, Dr. Patrice?
Yeah, so I think the topics came about by the conversations that were had in the focus groups. So I compiled a list of questions that we wanted to ask. And the responses were so powerful that a lot of times during the focus groups, we went into another direction. So after we were done with the focus groups, we transcribed their responses and we got together as a group and we picked out some of the themes that we saw that were common. Self-care came up, having conversations with your parents about your mental health, understanding what it takes to get the support that you need. So I think it was great that we were able to do it in 10 because there's a lot of areas that we had to cover. But what I was really proud about the community was that they were willing to share their stories. And they were willing to share the stories
all three of the different groups.
Even the kiddos. I mean, it took them a little while, but once we got some cookies and we were just chatting it up, they were the most impactful. There was not a dry eye when it came to the adults in the room of hearing what they were going through and how so profound they were talking about, their struggles and trying to explain to their parents and like their teachers what was going on, but everybody wasn't really hearing them. So I would say that I left feeling very grateful out of those focus groups to really understand it's not that people don't want help and it's not they don't know how to reach out. They are concerned that nobody cares. And that's what they've been conditioned to believe. So I felt like they all left those focus groups feeling like their voice was heard and that they were going to be able to make a difference by using their voices to help with these animations.
So when are we expected to see these animations?
The first 2 animations will be released this month. What we decided was we're going to put them out at regular basis each month and then create the programming around it. We've formed, Melissa Baker from Black Health and Anita Favretto, I think I'm pronouncing it correctly, from the library, and communications from Columbia, Carla Cantor, are working together on how we're going to make sure that the people living in the communities actually have access to this. And we're all going to use all of our contacts with local media, as I said, social media, and really try to blanket the waves with it. And also invite everybody to come to the libraries. Make sure it's a comfortable place and people want to be there and feel safe, and again, connect those who need treatment.
And it's interesting that the public library is a part of this group because I don't think typically we think about the public library when we think about mental health. So that is a very, I think,
It's
interesting.
very creative.
Yeah.
And we have to give really the Leon Levy Foundation the credit for bringing that together. You know, Columbia and the library. You know, I learned through this project that the libraries have been part of the fabric of this city, the New York Public Library, for I think 125
Absolutely.
years. And now they're really stepping up in terms of, you know, the issues that are important. You know, you were talking about adolescents. Our emergency room is full of adolescents. They seem to have suffered the most as a result of the pandemic.
Yeah,
Absolutely.
I think this the COVID still has is impacting us in ways that we will be experiencing for a long time. So we know about the animations. What other specific components of the program that we can expect to see or need to or want to hear about?
So the other thing, in addition to the animations and in addition to the face-to-face meetings, there will also be a dedicated website on the library's website. We will do it on our website. You will do it on Black Health's website, and that will have materials. The other thing that the project is doing, they are actually buying a collection for the involved libraries of books around mental health and addictions. And I don't want to forget addictions, because I think what we have seen as a result of the pandemic is an increase in overdose deaths. And so I think that is something very much on people's minds as well.
I think this is an exciting program because I think obviously during the height of the pandemic, we were all quarantined and we were basically concerned with staying healthy and safe. And at that time, obviously, the majority of us had not been vaccinated, so we weren't paying so much attention to that. And we were not paying and talking about mental health. And we know the impact that that was having just from the isolation, the separation, and especially for the students who could not be in school with their friends.
Yes.
And so now I am so happy to see and to hear more about attention being given looking at the mental health. So, Patrice, I wanted to ask you too about the type of project in the Black community. How do you think that this is going to help? And I'm going to ask you the same question, Louis, as it relates to the Afro-Latino community. What are the mental health concerns, and how do you think this project is going to connect and resonate out there?
I think this project is going to be really helpful. One of the things that we see when it comes to mental health is that we don't put a lot of cultural components into it. So the fact that these animations are going to look like the Black community, they're going to sound like the Black community, it's going to have the language that we talk about when it comes to mental health and what we're struggling with. It's going to be something that they identify with, and they're going to have conversations amongst their peer groups, their families, about how important it is to take care of ourselves, and whatever we're experiencing, we're not alone. So I think that this is a project that a lot of people are going to see the impact, and it's going to be duplicated everywhere. Because the one thing that we need in mental health is to understand that we are all human beings and we all go through things, but certain communities go through different challenges, and we cannot help them if we don't understand their culture and components. And this is going to be one of the first few animations and projects that I'm seeing that is really going to highlight those struggles that we see in the Black community, and it's going to be empowering for sure. I'm excited.
You want to speak to it from the Latino side of the Afro-Latino community side?
No, absolutely. I mean, historically, these are communities that have not been in touch with these systems. You know, they have been, they don't feel safe or they don't trust them, you know? And I think projects like this that are coming specifically from the community, because the wonderful thing about these 10 cartoons is that not only are you seeing people from the community in the cartoon, but direct quotes from the interviews that Dr. Douglas did are part of the videos, right? So people will hear their language, they will hear what they say, they will have an opportunity to talk to each other, to learn from each other, and to begin to say, you know what, I don't have to deal with this by myself. There are things that I could do, you know, and my community has resources. Let's find them, let's talk about them, right? again, in 3 different areas where these individuals don't look for help. They go to the hospitals when they have no other resource, you know? So this will open up a discussion that will give people the incentive to begin to trust the things that are out there, because there's a lot of resources out there, but people don't use them.
And I think even to know that Columbia Psychiatry is in touch with that, and that we have faculty like you, Louis, who come from their communities, and that we very much want to be seen as accessible and as a group, because we have so many talented, skilled faculty members. We want to share that. And we want to really enrich the communities that are part of our world. We don't always do that, and I think, you know, particularly Dr. Lieberman, our chair, is very committed to that. So it's an exciting opportunity for us.
And I think that's extremely important because I think in all of our communities where we have these large institutions, and Columbia University being one of them, where so much of the development has taken place at Columbia University, and there's not there tensions,
Yes.
you know, in the community. So to be out there and continuing, not that Columbia hasn't done, you know, community relations and work and so forth, but to continue, especially around a project like this, I think speaks volumes, and it is going to be of great value to that community where you're concentrated. So how do we spread this? I mean, are we going to stay?
No. I've already, and I'm sure, you know, Louis and Dr. Douglas, I've already been talking about this project. We know that the rest of the city is interested. We know that other counties in the state are interested, and we have interest actually across the country. Particularly, I'm hoping that we'll have other philanthropists step up in other parts of the country who have been, you know, will be as gracious as the Leon Levy Foundation has been to us.
So this is where we start, but this is certainly not where we stopped, right?
Absolutely.
That's right.
So anything else you want to tell us about this exciting program? Where do we go from here? And making certain that the word gets out there. And I think once you start the animations, and especially, well, all 3 groups, the young, the not so young, and everybody else in between, once they begin to see that, then that too will have a lot carry itself in a way.
Absolutely. You know, again, these are communities that historically have not been in touch with these particular resources. And this is such an important bridge. And it's done in such a way that is so friendly and so engaging that you know there's going to be a lot of discussion among community members when they start seeing this.
You know, and I think the other hope, and we haven't focused on that, is that some of the community agencies, and particularly some of the professional groups, will get to see these videos, will maybe come to some of the sessions we have at the library, and will begin to influence and bring different communities together. So that's something else we're very excited about.
Well, we certainly need to do more about bringing people together and bringing our communities together at this time. And COVID has just created such havoc in all of our lives, quite frankly. And so I think that this would be a good way to be able to address some of that. So, Louis, tell us a little bit more about the work that you're doing as it relates to addiction and
maybe a little bit about the center.
Yeah.
I don't think people really know about it.
Oh, well, we could talk all day about CPI. Well, CPI, the director of CPI is Dr. Lisa Dixon. She's a very well accomplished researcher and tremendous clinician. And we have a number of initiatives that are really state of the art. We provide a lot of support for providers throughout the state of New York, all levels, counselors, social workers, which I know you're one, doctors, nurses, and we provide evidence-based practices, training, coaching, consulting, and give people guidance, and have a phenomenal relationship, by the way, with the New York State Office of Mental Health, which is important because they're the policymakers, right? So our goal is to continue to move the professional field forward through evidence-based practices, and that's what CPI does.
And you've been with the Institute for how long now?
Close to 10 years now. Yeah.
Okay.
Yeah.
Okay. Anything else you want to share with us about the program that you want to make sure our viewers have not missed?
I want to make sure that they go to our website so they can see when the local programs are being held at the libraries. They will be able to go to columbiapsychiatry.org, to nypl.org/community mental health, I think, but we'll get that up and make sure it's right. And we'll also your website, because it'll be on all the websites, so we'll
And
make
when can
sure.
we anticipate that again?
By the end of the month, the first 2 videos will be out, and we'll soon have a schedule. The library is working on the website as we speak.
Yeah. Well, I think, Dr. Patrice, and you're all the way here from California. Anything you want to add?
Other than that, I'm excited for these to launch. Very grateful for the opportunity and the collaborations. And I think that this is really going to be impactful for the communities. And I'm excited to see the outcome of people reaching out for help and having these conversations of it's okay not to be okay, but it's not okay to stay that way. And here are the places you can go to not stay that way.
There was another question that I did have about the groups. What was the size of the group, especially among the younger group?
I want to say it was about 12 of them. And
what
it was
about the other two?
Mixed between, I think it was almost half and half with males and females, and the age groups I want to say was 13 to 17 for the teens, and then the young adults I think was 18 to 24, and then the seniors I want to say was either 55 and up, and we had about 12. We wanted to keep it intimate so that everybody had a chance to speak, which they did,
Right.
which was
Okay.
helpful.
And I'm so glad that each one of you had a chance to speak.
And
And this has
thank
been
you.
exciting, and we look forward to hearing more about it. And I certainly want to thank the Leon Levy Foundation for their generous support to make the project possible. And special thanks to each one of you, Dr. Patrice Douglas, Louis Lopez, and Linda Rosenbaum, for joining us today. And we know that it's going to be of great value. So for more information about the Community Mental Health Project, visit nypl.org/community mental health. And for more information about our organization, visit our website, nblch.org. And also look for us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact your health and well-being. So please let your family, friends, and neighbors know about this programming. I am C. Virginia Fields, and I thank you for joining us and hope you'll tune in next time for Health Action TV here on Manhattan Neighborhood Network.